Phenylketonuria, also known as PKU, is a metabolic disorder that results in decreased metabolism of the amino acid phenylalanine. Excess phenylalanine is converted into phenylketones, which can then be detected in the urine, hence the name phenylketonuria. It's an important disease to know as a clinician, so you don't want to miss it come test day. Let's jump right in. First, I want you to take a look at this urinal. Yeah, it's shaped like a funnel, or in other words, this is a funnel urinal. This funnel urinal should help you remember the accumulated phenylalanine, as well as the disease name phenylketonuria. Get it? Funnel for phenyl, and urinal for ketonuria. We've even filled this funnel urinal with some suspicious yellow liquid to really peg the urea in phenylketonuria. Alright, now let's review exactly what is going on here. Normally, phenylalanine is converted into tyrosine by the enzyme phenylalanine hydroxylase, and phenylalanine hydroxylase also requires the cofactor BH4 to function. To start, check out all the aloe next to our funnel. What? You don't lather your body in aloe after getting out of the shower? You animal. Anyway, the aloe next to the funnel here represents phenylalanine, a funnel for phenyl and aloe for alanine, right? But it looks like someone bumped into our little pile of aloe leaves here. We'll get back to this guy in a minute, but for now, check out where our aloe leaves are heading. That's right into the funnel. At Pixorize, we use splashing water to represent hydroxylation reactions. And see the splash coming out of the funnel? Well, it may not be water, but it represents hydroxylation all the same. Putting this together, the water splashing out of our funnel here represents phenylalanine hydroxylase. Now recall, phenylalanine hydroxylase converts phenylalanine to tyrosine. To help you remember tyrosine, check out where our splash is headed, right towards the tyrosine tire. Get it? Tire for tyrosine? Okay, so maybe it's less of a tire and more of a tire-shaped plunger. Or maybe it used to be a tire, but now it's a plunger. Regardless, they're both rubber. Woo! Recycling. Long story short, phenylketonuria is caused by defects in phenylalanine hydroxylase. It can also be caused by defects in phenylalanine hydroxylase's cofactor BH4, which we'll touch on in just a second. Anyway, a defect in this biochemical step will lead to high levels of phenylalanine and low levels of tyrosine. This is pretty obvious, but to help reinforce the association, we've put the phenylalanine aloe high up in the air and the tyrosine tire planted firmly on the ground. Okay, so we just talked about phenylalanine hydroxylase, but what about BH4? If you watched our scene on catecholamine synthesis, you would know that our recurring symbol for BH4 is a brush door. And of course, this bathroom also has a brush door. See it here? The brush should help you remember the letters BH, and the door should help you remember the number 4. It's the BH4 brush door. Anyway, this broken brush door should help you remember that decreased BH4 can also cause phenylketonuria. This subtype is termed malignant PKU, but the name here isn't so important. Instead, just remember that PKU can either be caused by defects in the enzyme phenylalanine hydroxylase or by decreased levels of this BH4 cofactor. Alright, so what happens when we can't convert phenylalanine to tyrosine? Well, for one, tyrosine becomes essential. Since patients with PKU can't generate tyrosine from phenylalanine, they need to consume it in their diet. Give tyrosine to treat tyrosine deficiency, right? This should be pretty obvious, so I'm just going to leave it at that. Next, as we mentioned earlier, PKU patients have elevated levels of phenylalanine. This extra phenylalanine can be converted to various phenylketones, which are also elevated. These include phenylacetate, phenylactate, and phenylpyruvate. These compounds can be measured in the urine, and the increased level of these phenyl-containing compounds should be obvious. Let's just remember our funnel here to help remember this fact. Next, let's explore what caused the splash and the broken brush door in the first place. Yeah, it happened when I hit that bath cart a little too hard. See that small bath cart? This small cart should help you remember the inheritance pattern of PKU, autosomal recessive. You see, we use small automobiles, like carts and smart cars, to represent autosomal recessive inheritance. This is in contrast to large dominant autos, like trucks and tanks. And of course, we have a small cart here. It's just a bath cart, after all. This should help you remember PKU's autosomal recessive inheritance. So now that we've touched on the biochemical cause and inheritance of PKU, let's talk about the clinical findings you should know. First, take a look at that turtle on the shower curtain I'm ripping open. Yeah, shower curtains always have cute aquatic animals on them. A turtle is Pixorized as a recurring symbol for developmental delay, because what's more delayed than a turtle? The accumulation of phenylalanine can be toxic to neurons, causing cognitive delays and intellectual disability. Just remember this turtle here to help peg this fact. Alright, So why was I ripping open the shower curtain anyway? It's because the water's just too hot, duh. Take a look at all these red spots on my skin. Yeah, these red spots kind of look like eczema. This picture should help you remember the finding of eczema in patients with PKU. Speaking of knocking into that bath cart, notice how I also knocked over that bottle of bleach. Ugh, it spilled all over my new bath rug, giving everything this bleach white color. Wait a minute, bleach white? Doesn't this kind of remind you of the fair skin seen in phenylketonuria? That's right. Patients with phenylketonuria typically have fair skin, which you can remember by picturing this bleach spilling here. This fair skin is actually caused by a decreased synthesis of melanin. If you watched our scene on albinism, you would know that tyrosine, and specifically its downstream product dopa, is used to synthesize melanin. So it should make sense that since PKU patients have less tyrosine, they also have less dopa, and ultimately less melanin. Next, notice how our bath cart here is shaking. This should help you remember the neurologic finding of seizures. I actually don't think this fact is super important, since we've already mentioned that excess phenylalanine can be toxic to neurons. It should make sense to you that neuronal damage can lead to a lot of different neurological symptoms, including seizures. Next, take a look at those sunflowers in my shower. They don't look so hot. Who thought it was a good idea to put sunflowers in the bathroom anyway? These dying sunflowers are not growing well, which should help you remember that growth retardation is observed in PKU. Again, this should be pretty obvious. Phenylalanine is required for certain proteins, therefore making it required for appropriate growth. Since phenylalanine is toxic to PKU patients, they can't get enough of it to grow correctly. Makes sense, right? Next, notice those fumes coming out of the toilet. Man, I don't know about you, but this bathroom smells super musty. This musty odor should also help you remember the musty body odor observed in PKU. This is an unusual finding, making it super high yield to remember. Recall from organic chemistry that a phenyl group is an aromatic group. Also recall that PKU patients have a buildup of phenylketones. This buildup of aromatic compounds leads to quite an aroma. Finally, take a look at the timer on the wall of the bathroom. You know, this is one of those timers next to jacuzzi tubs. That's right, this is a fancy bathroom. Anyway, this delay timer should help you remember that there's a delay before PKU can be diagnosed. At birth, patients are normal because of maternal enzymes that are present when the patient is still a fetus. Consequently, screening for PKU takes place 2 to 3 days after birth, so that way the ketone levels can build up and be detected. In summary, just remember this delay timer to remember that PKU screening takes place after 2 to 3 days. Alright, now that's it for phenylketonuria. Let's recap and get out of this bathroom, don't you think? Phenylketonuria, or PKU for short, is an autosomal recessive disorder caused by a defect in phenylalanine metabolism. Excess phenylalanine is converted into phenylketones, which can be detected in the urine. Hence the name phenylketonuria. PKU can be caused by defects in phenylalanine hydroxylase, or in its BH4 cofactor. Since tyrosine cannot be made from phenylalanine, tyrosine therefore becomes essential to include in the diet. The buildup of phenylalanine and decreased tyrosine leads to the clinical picture of PKU. Phenylalanine accumulation is toxic to neurons, leading to symptoms such as seizures and cognitive delays. Growth retardation and failure to thrive are also observed, and on exam, patients will often have a light or fair complexion, eczema, and a characteristic musty body odor. Finally, diagnosis is usually delayed until 2 to 3 days after birth, since infants are normal at birth due to the presence of maternal enzymes. Whew, alright, now we are done for real. Now let's get out of this bathroom. Why are you studying in here?